Assessing arterial blood pressure. Equipment needed: mercury sphygmomanometer, bladder and cuff, stethoscope, alcohol swab, sanitizer. Greet the client and introduce self. Explain the procedure to the client and ask client to rest for 5 minutes before measurement. Confirm client's full name and check ID band. Assessment. Determine the need to assess client's BP. Note risk factors for BP alteration. Observe for signs and symptoms of BP alteration. Determine best site for BP assessment. Determine previous baseline BP if available from client's record. Develop individualized goals for the client. Identify expected outcomes. Encourage the client to avoid exercise and smoking. For 30 minutes before assessment, position the client comfortably. Hand rubbing or hand washing. Provide privacy. Exposed upper arm fully by removing constricting clothing. Clean the stethoscope. Check if stethoscope is working or not. Palpate brachial artery. Position cuff to 0.5 centimeters above site of brachial pulsation. Centered bladder of cuff above the artery. Wrapped fully deflated cuff round upper arm. Check the manometer is on vertical position at eye level. Palpated radial artery with fingertips of one hand, while inflating cuff rapidly to pressure 30 m above point at which pulse disappears. Deflated cuff rapidly and completely. Place stethoscope earpiece in ears, and be sure sounds are clear. Check whether the stethoscope is functioning. Relocated brachial artery and place spell over it. Closed valve of pressure cuff. Inflated cuff to 30 mmHg above palpated systolic pressure. Slowly released valve and mercury to fall, at rate of 2 to 3 mmHg per second. Noted point on manometer when first clear sound is heard. Continue to deflate cuff gradually, noting point at which sound disappears in adult. Deflated cuff rapidly and completely removed from client's arm. Repeat procedure on other arm after 2 minutes if indicated. Wipe the cuff with an approved disinfectant. Cover the client assisted in returning to comfortable position. Clean the stethoscope. Replace equipment stiskered wastes. Informed client about BP reading. Informed abnormal findings to nurse in charge or physician. Hand rubbing or hand washing. Evaluation. Wait 1 to 2 minutes and repeat assessment if not audible. Tried alternative methods if not audible. Compare BP reading with other baseline. Identified unexpected outcomes. Record BP reading in Ashifa system vital signs flow chart. Document the reading in Nursing Cardex if indicated.